I want to keep on giving you little wisdom droplets of things you can do to help with your healthcare and those of your loved ones that you may not have heard of before or may not have taken a deep dive into. We do discuss this in UnCURABLE, From Hopeless Diagnosis to Defying All Odds. I do devote a chapter to it, but I want to talk about the concept of psycho-neuro-immuno-gastroendocrinology. Yes, I know, lots of big words, confusing. You can actually get a PhD in this field now. What am I talking about? The mind-body connection. And I want to specifically talk about trauma, big T trauma and little t trauma. One of the things I learned in my career when I started seeing patients with chronic Lyme, mold illness, post-concussive syndrome, long COVID, autoimmune issues, chronic fatigue, fibro, IBS, inflammatory bowel disease. I mean, all these seemingly unrelated things. The one thing that connects all of these is actually your nervous system. And the whole psycho, neuro, immuno, gastroendocrinology word that I said starts with your mind, connecting all of these things. And so one of the things we've learned is how your nervous system, being in a state of rest and digest, a curative state, a healthy, happy state, enables you to have more restorative sleep and enables your hormones to readjust more normally from month to month. Also allows your cells to turn over more easily. When you're not stressed, there's this thing called apoptosis, which is controlled cell death, where your body recycles old cells, turns them into new cells. Well, if you've heard of senescent cells or zombie cells or whatnot, that is when that whole thing breaks down and those cells get stuck. A great example of that is some of the stuff we've seen with long COVID and people having like the virus or spike proteins in their body for, months, 6 months, whatever. That phenomena actually is the monocytes not turning over, holding on to the spike protein and keeping inflammation going even if the virus left your body. And we see this with things like Lyme disease as well. We see with even cancers are an extreme version of cells that don't recycle and become eternalized. Your nervous system is an important thing through the thing called the cell danger response that helps your body heal and self-repair. And if you have trauma, it stops that entire thing. I started working with patients and I get people 60% better, 70% better. They get to a point, they plateau, they get stuck. And I was all, why are you stuck? Wash and repeat things. And one of the things I learned where there are 3 things where people's ability to self-heal and self-repair were getting blocked. And I named that the triangle of health, but it's gut health, which includes diet and a whole host of things, stress, and then sleep. The stress part is something that was ignored in my medical training. And even now, learning about trauma, it's like you can't, find a trauma therapist, find someone who does EMDR tapping, who does somatic work, who does family dynamic therapy. Like these are all different kinds of trauma therapies that aren't covered by insurance. And so people tend not to learn about it in their training unless they go out. And most of the good, it's not an absolute statement, but the trauma therapists I've run into actually had their own story of trauma that they had to work through. And what I found with my patients is their body gets so much better and gets stuck because their nervous system is just stuck. So what opened my eyes to this was my wife, my family, and just talking about different kids with her whose parents would be traumatized because they kid with special needs. I mean, sometimes these children will almost die a couple times a year. They go to the ER every month or two, and that traumatizes the moms, it traumatizes the families. And I started thinking about with my own family, with my son, almost died when he was 8 years old. He got crushed in the elevator. And the result of that was my wife, every time he would disappear for a few minutes, she would have a trauma response. And even when he popped back up, she would stay stressed, hyperventilating, couldn't calm herself down for hours. I started realizing, wait a second, this is an extreme. Is there a milder version of this? I was actually reading a book about the Battle of Somme and World War II. And I was talking about, according to the book, the mud was so bad, you had these planks to go to the front line. In the morning, people would go to the front line, come back in the afternoon. It was raining, it was really thick. When the mud was so thick in that part of France, if you fell off the planks into the mud, you could not get pulled out. And it was almost like quicksand, you'd slowly sink. So people would literally sink all day long, couldn't get pulled out. And if you try to pull your buddy out and you got pulled in, guess what? You were stuck there and going down. And so they go out to the front, come back in the afternoon, and they'd be like up to here, up to their neck. And within hours, they're going to be suffocating and dying. And the people actually were going insane. They lost the marbles, so to speak. And that stressor of slowly sinking, knowing your death is imminent and you're going to suffocate, which is a horrible way to die, it literally drove some people mad. And just to realize, there are forms of torture in which you do that. Water torture, where a little small drip over time can break even the toughest of people. How does that transfer? And that's one of the things I do with translational medicine, is thinking of all these nuances and how does this apply to my patients. We're realizing that having your own chronic health issue for years and years and years gives you your own trauma. I saw it with my wife when she started getting better. If any symptoms came back, the smallest amount of symptoms, she would spiral, oh my gosh, I'm going back to the way I was. And see that with patients as well. One patient I'm working with right now with chronic Lyme, actually, she had the diagnosis in her 30s of fibromyalgia and chronic fatigue. About 3 years ago, I diagnosed her with Lyme. She gets feeling great. She's doing awesome. But every time there's a little tweak in her health, she's like, am I going back to the way I was? And so we're at the stage now where she's doing great, but every time there's a little headache, body ache, a labs off, where her mind goes is, oh my gosh, am I going back there? And to see how that impacts people's healing process. So what's happened is working with trauma, talking about trauma, big T trauma is like the big stuff we all agree on: sexual, physical, emotional trauma, being in war, PTSD kind of stuff. But then there's the little T trauma, which can be just daily stressors, care of a loved one with Alzheimer's dementia, care of a kid with special needs. I've also learned that being in a family with a narcissist, like that chronic stress of someone who you're trying to get their approval and you can't quite get it, and you always are wondering, are they going to disapprove? And when you get their approval, they lavish love. You're the most amazing person ever. Never, when they do bad things, they have remorse. I'll never do this again, da, da, da. But because they themselves are stuck on themselves, and because it's a personality disorder and they don't see it, like people who are depressed realize they're depressed. People who are narcissists don't realize they're narcissist. The point being is that by itself, I've seen multiple patients who their trauma is their mother, their father, their sibling, their spouse was a narcissist, and being in a relationship for years gave them a little T, drop, water torture kind of thing that now other things trigger them. And so that's one of the things that, having the family I have, interviewing different people, talking to different people, seeing patients and learning from patients, has helped me realize that trauma, your mind, is one of the places where people's healing gets stuck. And so we kind of put together a whole thing, Connected Health, where we actually have gut, stress, and sleep. And we utilize those leverage points to help people's bodies start to self-heal and self-repair, which if you're listening to this right now, there's links and you can follow it to learn more about that. But the point is, like, if you're stuck in your healing, or someone your loved ones are, gut, sleep, but is there a trauma stress piece? If they've been sick for a long time, if I was a betting man, I'd bet yes. So hopefully it's helpful. We have lots of resources, actually free resources within the book proper. We have dozens of free resources available. Some of them do discuss trauma and a bunch of other things. Please utilize those resources. We put them there for you to help you get you back on your track to healing and health and wholeness. Take care, and we'll talk to you soon.